Good afternoon. My name is James Trudjari, and I'm the Executive Director at Legal Assistance for Seniors. It is my honor to welcome you to today's program, How to Motivate Aging Adults to Make a Money Management Plan, presented by Marty DeLima and Naomi Carp. This is the second in our series of 4 webinars addressing various topics on elder abuse. As you all probably know, when we hold the conference in person, it takes many dedicated people and agencies coming together to produce such a large function. And this webinar series is no different. First, I would like to thank all of our sponsors who continue to support the conference in the webinar format. Their continued dedication and excitement for the work we do is critical to the success of the conference, and we offer our deepest gratitude. In particular, I'd like to thank our top 4 sponsors: Michael Stevens, Probate and Trust Realtor, our Diamond sponsor; Campbell Green, our Platinum sponsor; and our 2 Gold sponsors, the Tile Shop and Acuna Regularly. Michael Stevens has been an incredible support to LAS and is always there to help with a great enthusiasm. If it involves supporting older adults, Michael is always there with a big yes, and how can I help? In addition to a high level of professionalism, Michael and his team at Highland Partners Real Estate bring much empathy and compassion to the many probate and trust sales they handle. Michael approaches each transaction, whether for his customers or working with conservators, attorneys, or other fiduciaries, with real understanding. Thanks to Highland Partners and Michael for your steadfast support of LAS over the years. Philip Campbell has been with LAS long before I came on board. For anything big or small, Phil is always helping LAS. From Campbell Green themed M&Ms to guiding the agency by volunteering to be the board president, Phil believes in older adults in LAS. Campbell Green is another of our longtime benefactors. Many of you know their legal practice in estate planning, probate and trust administration, and conservatorship and elder protection. But we here at LAS know Phil and his team as great friends and champions of the rights of older adults. Thank you, Phil and Campbell Green, for always being there. The Tile Shop, with their showroom in neighboring Berkeley, and Acuna Regularly with business in estate planning, probate and trust administration, and conservatorship and special need trusts, are our 2 Gold sponsors and have been supporting LAS's work around preventing elder abuse for many years. They are always there to support this work, and we really do appreciate that they continue to believe in the work we do. Thank you again to Tile Shop and Acuna Regularly. We have a whole host of sponsors at the silver and bronze levels that we are also incredibly grateful for. Many of these sponsors, like our Diamond, Platinum, and Gold sponsors, have been supporting this work for many years. They are our collaborators and partners and keep us excited to continue to do this work. At the silver level, we have Anderson, Yahtzee, Wang, Minton, and Horn, Fiduciary Accounting Services, Holland & Knight, and the Professional Fiduciary Association of California, or PFAC. At the bronze level, we have 21st Century Care Solutions, ARM Homes, Evans Law Firm, Golden Gate Fiduciary Services, IMT Associates, the Law Offices of Sonoy Rousseau, and the law offices of Phillips & Phillips and Lifelong Medical. We really appreciate all of our sponsors at the silver and bronze levels. And a special thanks go out to Office Information Systems and Supervisor Wilma Chan for their support of the conference. In addition, Golden Gate University has continued to support LAS in this webinar series with technical support and serving as an honorary event host. The Institute on Aging and their amazing staff continue to be wonderful partners in providing continuing education units for a wide variety of professionals. Last but not least is the team that has contributed their time and hard work over the past several months to transition this in-person conference to an online experience. Greg Bedard, Jenny Pardini, and the entire LAS staff. We truly appreciate all the work they have done. For those of you who have been coming to the conference regularly over the years, you might notice that there is a familiar name missing from that thank you list. LAS lost our colleague and dear friend, Katie Brady, earlier this year. Her bright smile and positive energy will be sorely missed at the conference and throughout the year at the many events that she would attend. Katie was a champion for older adults, a thoughtful and caring coworker, and an avid softball player. Katie brightened any room she walked into. And as Katie used to say, go team, go. Now, for some housekeeping, before we get started with today's program, we have a wonderful educational presentation followed by a live Q&A. If you have a question, please submit it through the Q&A icon at the bottom of your screen. Staff will be monitoring these questions for the moderator. We will try to get to all of your questions, but if we're unable to answer everything during the session, we will do our best to follow up with you after the presentation. For those of you who need continuing education units, you will receive a post-event email within a day or two of this session with steps on redeeming your credit. Lastly, we welcome your feedback to help us improve your experience and continue to offer high quality education through a post-event survey. As I'm sure you're aware, today's presentation is part of a series of 4 webinars LAS is producing in the coming weeks. They are all free of charge and open to the public, though a donation of $25 per webinar will be gratefully appreciated and accepted in order to support our ongoing work. We hope you find these presentations informative and useful. You can register for these webinars by visiting our website at lashighcap.org. That's LASHICAP.org, and going to the events page. Thank you again for joining us, and I hope you enjoy the program.
Good afternoon. My name is Jenny Pardini, and I am the Community Education Coordinator with Legal Assistance for Seniors. I am delighted to be your moderator for this webinar. Today, you'll hear a 1-hour educational presentation from our guest speakers, followed by a Q&A that I will be moderating. If you have any questions for our speakers, please submit them at any point during the program by clicking on the Q&A icon at the bottom of your meeting screen. If you have any technical issues, you can ask us in the chat, and our technical team will do their best to assist you. If you would like to use the closed caption feature, click on the live transcript button at the bottom of the meeting screen and choose Show Subtitle. It is my pleasure to introduce you to today's speakers, Marty DeLima and Naomi Carp. Marty DeLima is an interdisciplinary gerontologist and assistant research professor in the School of Social Work at the University of Minnesota. Using both quantitative and qualitative research methods, Professor DeLima studies retirement security and financial victimization using focus groups, in-depth interviews, surveys, and panel data. Her research is funded by the National Institute of Justice, the National Institute on Aging, the Social Security Administration, the Society of Actuaries, AARP, and the FINRA Investor Education Foundation. Prior to joining the School of Social Work, Dr. DeLima was a research scholar at the Stanford Center on Longevity. She graduated with her doctorate from USC School of Gerontology, where she conducted research on elder abuse and neglect in minoritized communities, evaluated outcomes of multidisciplinary teams' response to elder abuse, and analyzed the tactics scam artists use to deceive older adults. Naomi Carp is a consultant on aging, law, and policy for educational, governmental, and nonprofit clients. She's a lawyer and policy expert who has worked on aging issues for over 35 years. Her areas of focus include elder financial exploitation, guardianship, health and financial decision-making, the impact of cognitive changes in family caregiving. Ms. Carp is the co-author of the Thinking Ahead Roadmap, a guide to and web-based tool to help people keep their money safe as they age. Until October 2019, Carp was Senior Policy Analyst at the Consumer Financial Protection Bureau's Office for Older Americans, where she helped set the office's priorities when the agency opened in 2011. At the Bureau, Carp was the team lead for the Managing Someone Else's Money Guides for financial caregivers. Ms. Carp began her career as a legal services attorney for low-income and older clients and received her JD from Northwestern University School of Law and her BA from the University of Michigan. Naomi and Marty, welcome to the program.
Hi, everyone. I hope you can see my screen here. I am Marty DeLima, and I am a co-author of the Thinking Ahead Roadmap. And today I will be presenting with Naomi Carp, another co-author and collaborator on this project. So how we're going to use the time today is, first, I'm going to tell you why it's important to engage in advanced financial care planning. And then we're going to talk about some of the research steps that myself and my team members engaged in to try to inform this toolkit. And we'll go over the 6 steps of financial advanced care planning. And then Naomi is going to give you a preview of those materials that you can use in your own practice. So we'll finally conclude with some next steps. We're going to talk about dissemination and how to get these materials into the hands of older adults who are ready to start on their planning journeys. So I'm a researcher by training. One of the things that I study is how changes in financial decision-making impact susceptibility to scams and fraud. And this is data from a study that was conducted by some of my colleagues at Rush University Medical Center in Chicago. And they run something called the Memory and Aging Project, where they recruit cognitively healthy older adults to be part of this longitudinal panel study on aging. And at the end of the older person's participation, they've had over a decade's worth of cognitive data and other psychosocial measures that are administered to the person every year. So what they found in this one study that's been published from that data is that the majority of older adults don't go on to experience Alzheimer's disease. So at a year 7 or so, only 22% of that sample had dementia, but roughly 78% was still cognitively healthy. So they're on that top red line, the normal agers. But in a subsequent study, they looked at those normal agers and they found that still 30 to 40% of them were showing suboptimal financial choices when they administered certain financial literacy tests that even asked about more sophisticated financial decisions and healthcare related decisions. So this is really concerning because it can indicate that even in the absence of dementia, older adults may have trouble with financial decisions. Another group of researchers administered a financial literacy questionnaire to adults of different ages. So this is not a longitudinal study like the one I just showed you. This is cross-sectional. So what they found is that adults in their 80s scored significantly worse on this financial literacy questionnaire than adults in their 60s. But when they asked participants to rate their confidence in their answers, so how correct they think their responses were, they almost saw an increase, greater levels of confidence in adults in their 80s versus their 60s. So what this indicates is that there's this widening gap between actual performance, financial performance, and perceived performance. And that is very insidious because it can suggest that older adults can be experiencing financial difficulties, but they lack the insight to recognize those difficulties. And in fact, other research on Alzheimer's disease found that these changes, these subtle changes in financial decision-making can occur up to 10 years prior to the diagnosis of Alzheimer's disease. So that's long before family caregivers and others might be involved in the financial choices of an older adult in their financial affairs. So what does this mean? Well, it creates incredible risks for fraud and exploitation. And many of us have seen headlines like this from the New York Times to Bloomberg, stories about older adults who've been deceived either by strangers or taken advantage of by family members. Even there's policy about financial exploitation. It's quite frequent in the news, especially with COVID. And from my research, we know that fraud is very prevalent among older adults. The FTC does a study on the prevalence of scams, and they found that 1 in 18 older people are victimized by a scam each year. $50 billion is lost to fraud annually. That's just an estimate. The true numbers are much harder to assess because of lack of reporting by victims. And we know that there's billions more lost in cases of financial exploitation by family members. But in my surveys and my interviews with victims of fraud, I find that the cost of fraud goes far beyond the financial. Victims report feeling deeply ashamed, that they're embarrassed, they wanted to hide this information from family members, with some people even reporting, broken marriages, depression, and thoughts of taking their own life. So again, really serious emotional consequences in addition to financial consequences. So my colleague Naomi and I are going to argue in this presentation that coming up with a plan, a money management plan in advance, can be a hedge against those risks of financial exploitation and fraud, and also just pretty serious financial mistakes. But it does more than that. It also eases the uncertainty on future decision makers and potential burden on future decision makers because you've given them a roadmap. I apologize, I have another computer and the phone through the computer is ringing. Another thing that having a plan does is that it increases the odds that financial needs and expectations are going to be honored by the person that you have chosen to help you manage your money in the future. So I'm going to do a poll now. So if you've turned away from the webinar, I encourage you to come back online. So I'm going to present the first question. So I want to know, and please moderators, if it's not showing up, let me know. I want to know what proportion of US adults age 50 and older have a power of attorney. What do you think? And I'll give people, another 10 seconds or so to answer this question before I reveal the answer. Okay, we've got nearly 75 people have responded. We'll get those last responses in. Okay, so I am going to reveal the answer. Okay, so we had, let's see, 10%, less than 10%, about 35% of folks listening in voted for the first option, option 1. 10 to 20, that was 32% of individuals. Oh, I can share the results. Here we go. So now you can all see. And then another quarter of us or so said it's between 21 and 30%. And then finally, no one said only one person said greater than 75%. So let me show you the results from up here. So the correct answer is 23% of older adults. I do want to say that this data is a little bit outdated. It's from 2013. Of adults age 60 and older, the most recent data from 2019 is that 39% of adults 60 and older have a financial power of attorney. Okay, we're going to do another poll. This one, I'm going to pull it up, poll number 2. So I want to know what proportion of US adults age 50 and older haven't made an informal money management plan for someone to take over for them in the future. So we're not talking about an official power of attorney. This is an informal money management plan. So go ahead, submit your responses. And I'll give it another 10 seconds or so. Okay, so I'm going to end and share. So we have a much more even distribution here in responses. So it looks like the largest number of people, the greatest proportion was 34%, said it's between 31 and 50% of adults 50 plus. The next group down is the 21 to 30%. Well, I will do a reveal here. So it's actually fewer than the official power of attorney. It's only 14% of older adults have made informal plans for someone to take over for them. So this is that data from the Federal Reserve Board from 2013. And there is a positive news story in this data. It shows that as people age, so as they kind of enter into the older decade, as they move up in a decade, the odds of having a plan increase. So you can see these 70 plus year olds, they have, only 27% have made no plans at all compared to those in their 50s, where 56% of Americans have said they've made no plans. We also see up to 46% now in their 70s have a financial POA compared to those in their 50s, where only 16% have a financial POA. But still, the kind of the main headline here is that the majority of older adults are not planning for changes in financial decision-making, and that is cause for concern. So my colleagues and I, we thought, well, what are the key steps in advanced financial care planning? What is it that people really need to do to secure their financial futures? And also, how do we motivate people to engage in advanced financial care planning? And then finally, where are there kind of gaps in knowledge? What points do people need education? So here is my research team. I'm Marty DeLima, and you're also going to hear from Naomi Carp. Also with us is Steve Vernon, who is a retirement and finance consultant. And he provided kind of the financial lens. And then my graduate student at the University of Minnesota, Mingyang Zhang. So this research was funded by two organizations. The Society of Actuaries provided preliminary research support, and then AARP funded more research as well as the development of the toolkit and the materials that we'll be sharing with you today. So what did we do? We started off with interviews. These were semi-structured, in-depth interviews. We talked to professionals like elder law attorneys, financial advisors, daily money managers, people who provide services to older adults. We also spoke to healthcare professionals as well to get their perspective. We interviewed some older adults as well as caregivers of older adults, but these were not related. They were not family members of each other. And then after collecting that data, we wanted to kind of dig deeper into potential differences in culture and race and ethnicity, and also in socioeconomic status on kind of feelings and motivation to plan. So we conducted 4 focus groups that were divided or grouped by race, ethnicity, or by income. And then finally, we did an online community forum where a moderator would post questions in the morning and in the afternoon. And over 120 older adults participated in that community forum, responding to one another's posts or making their own posts. And it was lasted for 2 weeks. So these were kind of questions to really get at motivation, at language, at personal stories about planning or issues that arose because there was a lack of planning. So here's what we found in terms of the barriers to advanced financial care planning. One of the most important ones that arose was just a denial of future need. And in fact, one geriatric care manager said to me, she said, people are really good about thinking about their death and kind of the end. But where we are really poor, we're really poor at thinking about long periods of disability. And so many people in our survey or in our focus group and also in the community forum, they just didn't think they would get to a point where they would need this, or they were in denial about it, or they tried to make jokes about wanting to die before they got to that point. Another one for some people was just a lack of available advocates. So people who could be there to provide assistance with money management. And this was more prevalent among people who were aging solo, so that who didn't have a spouse or didn't have adult children. But it was also occurred in some families where there were adult children, but just none of them could be trusted with this responsibility. Some individuals, especially in our low income focus group, felt ashamed about their financial situation, and they didn't want to reveal their levels of debt or other issues with family members. And then kind of this other group of people had tried to talk to their family about planning in the future, but they just got pushback, especially from adult children who said, "Mom, you're fine. Why are we even talking about this? Like, let's deal with this later." Other issues were, dysfunctional family dynamics, lack of trust in a family or in a larger social network. But then there was a lot of, really modifiable areas, we thought, like lack of knowledge about POAs. Some of our focus group members, got POAs mixed up with advanced directives or thought that they had a will, that this was already encompassed in the will and that, they wouldn't need any other documents. And others just thought POAs were for wealthy people. And since they didn't perceive themselves as having a lot of assets to manage, they wouldn't need it. And then finally, poverty. So people in poverty, are in this cycle of, not being able to think that far into the future. And if you don't know how you're going to pay your rent that month, these folks were not in kind of didn't have kind of the space to really think about the long-term future and making these types of plans. So those were the core barriers that I wanted to discuss. We're going to do another poll. So again, let me move into poll 3. And here are some reasons that people might create a financial care plan, but I want to hear from you. If you had to pick one of these 5 reasons why you would plan for the future, what reason would you choose? So there's no right or wrong answers here. This is more, I'm just curious to see what this audience feels would be the driving motivator for them. So we'll give people another 10 seconds or so. I still see responses coming in, so I'll give people a little more time. Okay, so I'm going to end and reveal. So here's what you said. So quite a few reasons across the board. Important ones were peace of mind, protecting your finances from fraud, abuse, and mistakes, greater autonomy and control, really kind of more of an even distribution. Well, I want to share with you what our online community forum participants, who are all age 60 and older, what they said. So we had them do a similar exercise where they had to pick the top reason. And for them, it really, the most, I guess 38% of the sample said for them, it's peace of mind. But many of them said, it's peace of mind because all of these other reasons, staying in control, not being a burden on my loved ones and feeling more safe and protected, all of those feed into this idea of peace of mind. But you can see that, although 38% of people chose peace of mind, there was a lot of distribution here, just like there was for the folks who are tuning in now, where different reasons are motivating to different people. So, I can encourage you as you talk to your clients or you work with older adults or even just older family members, maybe one of these reasons isn't really working. So you might have to kind of touch on all these additional benefits, like easing being a burden on your family, like avoiding financial fraud, and kind of helping the family work together or everyone get along as motivators rather than trying to focus just on one. The other thing that I wanted to share is that we tested a lot of messaging with older adults, and we found that positive messaging was more effective and people were more motivated by the positive messaging, like peace of mind and autonomy, than they were negative messaging. And negative messaging is more like you should do this to avoid fraud and scams, and talking about dementia and cognitive decline. So you'll see in our kind of final product that we created out of all of this, we hardly use those words at all because we didn't want to put in any words that would be a turnoff to older adults from getting engaged. So our participants also gave us really great little sound bites about why this is important. Extra effort now can provide peace of mind later. It's not a matter of losing control, but of gaining oversight and assistance. And failing to plan is planning to fail. So what I'm going to do now is I'm going to share with you a video of kind of a combination of different interviews that I did with those online community forum participants, just to hear about their experience and why they engaged in advanced financial care planning.
How would you feel if I were to name you the person in charge of taking care of things? Should I die? Should I get sick? And he said, you know what, Mom? I would not have a problem with that.
After going through certain things with my mom, she never got that far. We thought, you know what, we hate to put the money out for attorneys and, do this and do that, but we have to do it. And the last thing that my husband and I never wanted to do is be a burden to our children.
My son originally had looked at becoming a minister, so he's very, very honest. I know that he would give his very best effort for us no matter what. He wouldn't take any easy outs. And at first he just kind of laughed and he said, "Oh, Dad, nothing's going to happen to you. You know." And I said, "No, really, it's something we should address." And then over the course of the next couple hours, I had him convinced that he needed to take that role, and he was happy to do it.
Everything you need to know is in here. This is it. This is where it is. Whenever it happens, it's all there. The name of the agents. You don't have to worry because it's all laid out. Just be an open book so that, when the time comes, don't be secretive. It's family or, whoever you choose, somebody that you trust. Be open and do it while you're healthy.
But the important thing is not to cover everything. It's to cover the most important things. The little things, they can be, that can be decided last minute, but the important things have to be discussed.
I think my son, after I brought up the subject of this, it almost made us closer in a sense, because he felt a real appreciation for the fact that I asked him.
Being that we're in the times that we are right now, it was easier. Yes, I was nervous about it. I didn't know how he was going to react. But at the same time, I figured that he was going to be receptive to it just because of where we are.
Don't put it off, because once you're gone, or, if your mental capacity is diminished, you have no control. You want your wishes known.
I don't think that we have time to waste anymore. We live in uncertain days, and from one day to the next, we don't know what's going to happen.
If I had a good friend, somebody I really cared about, and they really didn't want to get an advocate because maybe they didn't want to share personal information or their financial history, or they were thinking nothing's ever going to happen, I would be very quick to point out the trade-off between not sharing the financial information and getting the help is very much in favor of getting the help. Go ahead and get the help, pick somebody you trust, and get it set up and be prepared for the future, whatever it holds.
Okay, so next I'm going to turn it over to Naomi Carp, and Naomi is going to talk about what the steps of advanced financial care planning entail. And Naomi, I will do the next 2 slides, and then I'll turn it over to you to preview the materials. And just so you know, you're still on mute.
Okay, that always seems like the simplest thing to remember is to unmute, but it's always the thing you forget. Anyway, thanks a lot, Marty. Thanks for setting the stage and sharing the video and giving people a little bit of a flavor of the folks we talked to and the things that they had to say. So as Marty said, based on what we learned in the different types of research that we did, we developed a sort of a paradigm for the advanced financial planning process and a tool to help people as they age. And what you're seeing here actually are the steps in the Thinking Ahead roadmap. And what I will do is walk you through the website so you can see it in a little bit more detail. But as you're looking at these different steps, what is the Thinking Ahead roadmap? What is it that we thought we should develop after we did the research? It's a comprehensive toolkit that guides you to select someone you trust to help manage your money if financial decision-making becomes too difficult in the future. And as you'll see from the website, it's an online tool that can also be downloaded and printed for free. It's not just for people with a lot of money. You'll see things as I go through it that are clearly for people who have more resources. For example, we have a financial inventory, and some folks are not going to have all the kinds of assets and accounts that are listed there. It's really for everyone because everyone has bills to pay. Everyone might own a house or some other property, even if they do not have much wealth. And also people may have debts to manage, and that's part of the financial decision-making and financial management that has to go on. We developed a set of planning steps and preparations so that someone who we call a financial advocate, and more on that in a minute, can get ready to help people with their finances if they need them to later on. So the steps prepare the person who's doing the planning to help the financial advocate and to ensure that their wishes and preferences will be honored. And the steps are also there to help the financial advocate who may have to step in later on. And just a quick note on when should people engage in this advanced financial planning process. Really, whenever people are ready. But in our view, definitely by the time they're, in their early 60s, by age 65. And I would say sooner if they have health conditions that suggest that they will definitely get to a point where they need help. And as Marty said, the goal is to protect yourself against financial mistakes, fraud, and financial exploitation. And then also just to have your finances taken care of in a way that you would want them to be taken care of. So we're going to move on and do a demonstration of the website. So I am going to share my screen. And hopefully you can all see the homepage for the Thinking Ahead roadmap. So I'm going to assume that that's here for you. When you go to thinkingaheadroadmap.org, this is the landing page, the homepage that you will get to. And we start out with a video. We have several videos, the one that you saw already and some other ones to just give some examples for people and make it more relatable. And we have some preliminary information here. We use kind of the roadmap graphic to just set this up and explain to people the basics of why they might want to do this. And then when you click here to get started, you go to what we call the money path. And this is the intro to the money path. It takes you through these 6 steps that you saw listed on the slide before: choosing the advocate, organizing your financial information, starting the conversation with the financial advocate, explaining what you might need and want in the future, taking that step to make it official, appointing the advocate as the agent under the power of attorney, and then some thoughts about shifting the money management to the advocate when the time is right. Just quickly, that term financial advocate, we did a lot in our research in the focus groups and in the online community forum. We talked a lot about, what should we call this person? We don't want to use overly legal terms, surrogate, agent under power of attorney, et cetera. People really liked the term financial advocate because it connotes it's someone who's on your side, in your corner, advocating with you and for you. So that was the term that we chose. It resonated very well with people. So then we start going down the money path and we go to the first step, choosing the financial advocate. This part of the website explains, first of all, what are all the things that a financial advocate can do? And really, they're the things that any adult would do when taking care of their own finances. But we thought it was helpful to kind of articulate the wide variety of things that this person might do on your behalf in the future. They might not have to do all of them, but we kind of list them, and then we have a handout. And throughout the website. We have these little click here where if you click there, it'll take you to a printable, downloadable handout. This one goes in more detail about what does a financial advocate do, manage daily finances, navigate things like health insurance, Medicare, Medicaid. You know, we make a point of stressing that public benefits are part of the picture here, managing investments and sources of retirement income, and then other kinds of tangible property like your home or other real estate. Going back to the main website, then we talk about how do you decide who is the best person to be your advocate? And we hit some of those key qualities, the positive qualities listed here. You know, everybody's number one was trustworthy, honest, you know, on the same page with you, smart, that kind of thing. And then also things, and we discussed this in our focus groups and our online community forum. What are some things to avoid? You know, some of them seem obvious, but we want to emphasize them. You know, people who aren't very good at managing their own money probably aren't a great choice. People who gamble, take risky behavior, perhaps have some mental health or substance abuse challenges, that sort of thing. And then we have a little section on, can my spouse or partner be my financial advocate? And the answer is, of course. In fact, if someone has a spouse or partner, that is often the logical person who they would select. But we do give the little caveat that, you know, at some point, one of you is probably going to be aging alone. And so even if you do pick that person, you probably want to have an alternate. In a power of attorney, you would make that person perhaps a successor agent, someone who's younger, someone you would trust as well. So just sort of recognizing that if your main person you're picking is in your age range, you want to have a backup plan. And then you know, people are still often going to have a hard time coming up with someone, and we try to go through, you know, some of the what ifs. What if you don't know someone? You know, perhaps you can pick more than one person or divvy up different roles. What if no one in your family or none of your friends, people close to you seem right? You might have to hire a financial professional. Could be a daily money manager, could be some other type of fiduciary. So we go into that a little. And then something we thought was very important, what if you are aging solo? And that can mean a lot of things to a lot of different people, but if you don't have a spouse or a partner, you don't have adult children, you might consider yourself to be aging solo and having a harder time figuring out who can and should be that financial advocate. So we created a separate short document on aging solo, where we kind of walk them through how they might think about this, and including things like how to look into hiring a professional, what type of professional might be able to serve for you, what those different categories are, and then how to find one. We have some links to some of the organizations who can help people find someone, preferably in their area, who can serve in that role. Sorry, just need to, having trouble getting back to the top of my screen here. All right, let's go back to the money path. So now we're up to creating a financial inventory. And we don't necessarily mean anything formal here, but we mean, you know, part of planning is getting your finances organized, both for yourself and for that person who may be stepping into your shoes in the future. And we give them some tips on what kinds of things your inventory should contain, and the fact that you should periodically review it and update it. And we created a template for people to use if it's helpful for them. And I'll just click here and show it to you. This template is basically a fillable document. We suggest that people download it. They can't fill it out on the internet like this document is right now, but it goes through different categories: financial accounts, living expenses and bills, any loans that they may have, insurance payments, sources of income, real estate and personal property. And I think I skipped something. Yeah, and then a contact list for those service providers. Where should you keep this information? We talk about the pros and cons of keeping it on the cloud or having a hard copy, and some other helpful tips for keeping your money safe. And then I'm not going to click on this. The roadmap does not give people retirement income advice or investment advice, but we do have a document that just gives some very basic tips on, the need to have a retirement income strategy so that you do have an income stream and you are protecting yourself against fraud and abuse. So moving along, we get to step 3, start an open conversation. And honestly, when we started this project, our main goal was to help people with having these conversations. We knew anecdotally, both from the financial arena and from the healthcare decision-making arena, that a big barrier can be just the difficulty people have talking among themselves, among families, or among trusted people about, dealing with the fact that they might need someone to step in and make decisions in the future. The resistance could come from the older generation that doesn't want to deal with it, or it could come from the younger generation who, is just not willing to think about mom or dad or the aunt or the next door neighbor declining and needing help. As we got more into the project, we realized that yes, the part about starting an open conversation and how to have those conversations is very, very important, but all of the other steps are really crucial to help people really activate a plan. But starting the conversation is important. We have a video about the conversation. Then we give some conversation starters that people might try. And not only do we give the conversation starters, but then we go to, what if you get resistance? So here's some responses that you might get. This is depressing. I don't want to think about it. Oh no, are you sick? What are you not telling me? All of those kinds of things. And then we give some suggestions on how to get past those. So we do the conversation starters and the things to help move it along. We suggest people don't start out with all of the details. They start with the general request. And the first conversation is really to get that person on board with agreeing to be your financial advocate. And we have a handout that gives them tips on what does that mean? What does it mean to manage someone else's money? Keeping the conversation going. Okay, so you've had the first conversation. Hopefully the person who you trust and who you want to step into that role has agreed to take it on. What happens next? Well, in addition to the practical things like telling them where your financial inventory is stored, how to access it, and how you want your money to be used, you want to talk about your values. How is it that you want to live, and how is it that you want your money spent and managed if you can't do it yourself any longer? And one way we came up to help people with, we call thought questions. So you click on the thought questions, and we have actually like a little multiple choice quiz. And it has questions like, if I had an extra $200 a month, what would I want my financial advocate to do with it? You know, this is where you would show, well, donating it to a nonprofit or a charity is important to me. Helping family members is important to me, or treating myself well, or saving it, don't spend it, that kind of thing. And we have some other hypotheticals that we hope would help guide the advocate to know what to do if those kinds of situations arise. And then we talk a little bit about, it's important to talk to the advocate, but you and your advocate are not living in a void. You're probably in a family, an extended family, maybe a blended family. So it's important to share some information with others as well. So everything is out there. It's clear who the advocate is. Perhaps you want to talk to people about other parts of your life that you would want them to step in and help manage. However, we acknowledge that sometimes some family members might be difficult or disruptive, and it's up to you to decide who to include in these conversations. So now we're moving to step 5. And here's where we get into the legal issues a little bit more. This is the make it official step, where we say, you know, all of this is great, but in order for your advocate to step in and act, they will need legal authority to pay the bills, to make withdrawals, to manage your investments, to talk to financial institutions, and so forth. So here we have somewhat of a primer on powers of attorney. In our view, generally the most direct and complete method to give the financial advocate the authority to step in is through a financial power of attorney. Now, that may not be true in every situation. For some people, a trust might be important, or might be a better way to do it. So we acknowledge that, but for the great majority of people who don't have complicated finances or don't have a lot of assets, it's the power of attorney. So we go through a bunch of questions about what is a power of attorney, how is it different from a will or a trust, and so forth. And everywhere where there's this little plus sign, that's going to expand, and that's how you're going to get to the answer. And I won't go through them all now, but we certainly hope you'll go through the website after this webinar and see all of the other resources that are there. And then we talk about, and we acknowledge that, you know, with giving someone that kind of authority, there are pitfalls, and someone may not always do the best job, or may not, you know, in those unfortunate cases, perhaps won't be acting with your best interest at heart. So we do want to suggest to people that you trust the person, but a little verification that they're being honest and doing okay is a good idea too. So we talk about ways you could build in, you know, having that person perhaps give an accounting to someone else every so often, so that there's another set of eyes on your finances. And then we talk about resources for getting a power of attorney, free legal services, fee-for-service lawyers, and we touch on, you know, getting the documents from an online source, but we also talk about the pitfalls of getting a power of attorney where it's not tailored to you. Everyone's needs are different, and we want to make sure the document really serves well the person who needs that document. And then this click here, I won't click here, but in order to give people just an example of a power of attorney, we've included the power of attorney form from the Uniform Power of Attorney Act developed by the Uniform Law Commissioners. It's not here so people will just take it and execute it and use it, but it's here so they can see what a carefully drafted quality document would look like. And then finally, getting to step 6, planning the transfer of responsibility. This is hard because it's really going to be different for everyone, and it could be many years until it's needed. And there's no really pat, easy way to say, okay, when this happens, this is when someone needs to step in. So we've talked about blazing red emergency signals when it's probably time for a transfer of responsibility, or at least some of them. And those are things like you're starting to make a lot of mistakes with your finances, you've been diagnosed with dementia, that kind of thing. And then the yellow caution signals are things where perhaps alone it doesn't mean it's time for someone to take over, but perhaps in combination, it might indicate that you need help. And I will leave those to you to go through. And then just some things that you should do, again, with your financial advocate in advance. At some point, doing a more detailed walkthrough of your financial inventory. Maybe you don't want to share all that information right away, but somewhere along the line, you want them to get a little more familiar with your finances. Mentoring your advocate on some of these tasks, you might have them go with you to the bank, see how you do things on a monthly basis and that kind of thing. Introduce them to your financial advisors or tax professionals if you have them. And importantly, giving them a copy of the power of attorney document. So those are the 6 steps. I'm just going to click for a moment on downloads. All of the documents here, including a comprehensive document of the full roadmap, are available for download. And actually the full Thinking Ahead roadmap document that you would click on this first download button has even more detail than the website. So there's even more content there. And then those other little click here extra documents are all listed here too. Advice for solo agers, what the advocates need to know, and so forth. So with that, I'm going to encourage you to take a look at the website, and I'm going to stop sharing my screen right now. And Marty, I think we had a couple more slides. Okay, so just quickly to talk about next steps. One of our next steps is to develop workshop materials for people who we think can be facilitators for sharing this tool with people who can use it as they age. And there's such a broad spectrum of people who we think can help deliver this content to folks who can use it. Retirement plan sponsors, employee assistance programs, senior centers, faith-based communities, legal aid organizations, private attorneys, et cetera. And so what we plan to do is have a little kit for facilitators that would have a facilitator's guide to help them, with making presentations about this material. Presentation itself, like a PowerPoint they could use, and handouts that they can use to participants. We think there are many other things that we would love to develop as part of the suite of tools for the Thinking Ahead roadmap. One of those is, or a couple of them are, to have a roadmap that's a little bit more specifically oriented towards low income populations, also minority older adults, a Spanish version that would not just be translated, but also would be culturally sensitive and might have some other specific content. And then I know personally, we have heard a lot from folks out in the field in the course of this about the needs of solo agers and how there aren't a lot of great resources and options for financial advocates out there. So I personally would love to do some more work on solo agers and having a advanced financial management plan that's specifically tailored to their needs. And so I think we have gotten to the end of our content now. We are certainly looking for your help. We hope that you like the tool. We hope that understanding the research that we did leading up to it indicates to you that it's definitely very much evidence-based and based on kinds of things that resonate with older people. So we would love to have you help disseminate information about it, use it with the people you serve, and we are happy to answer some questions. So I think we are done with our presentation and ready to start addressing some questions. Thank you.
Thank you, Marty and Naomi, for that amazing presentation. Financial planning and money management are so important in feeling secure as we age. And our audience has many questions, all of which we hope to get answered in our Q&A. We have 15 minutes set aside, so for anything we don't get answered today, we will follow up with guests after the presentation. As a reminder, if you have any questions, please submit them in the Q&A icon at the bottom of your screen. In order to see all of us on screen, click on Speaker View in the top right corner of your screen. So hello, Marty and Naomi. Let's go ahead and get started with our first question. And that was, if someone has power of attorney, is that not a plan? Could you explain the difference and how one would go about creating either?
So I think Naomi and I would both argue that that's a really important component of a plan. But a huge part that might be missing if a person only has the power of attorney is the conversation piece. And when we were setting out to design this, that was the main, social problem that we aim to tackle, is how do we get people to talk about their finances with their family members? So, and for me personally, this became a little passion project for me because I'm my parents' financial power of attorney. But if something were to happen to both of them tomorrow and I had to take over, I wouldn't know what to do at all, because my parents haven't sat me down and had that conversation. So that's why we're like, no, we need to make this more comprehensive and kind of guide people to doing the power of attorney ultimately as kind of the gold standard. But there are these other critical components that if you just have one and not the other, you can still kind of reach a failure point in the future. So thanks for that question.
And the only thing I would add to that is, and this is partly through the conversations, but partly through using things like those hypothetical questions to get at people's values and preferences. The document gives someone legal authority, but doesn't really necessarily give them a roadmap to help you continue to live out the rest of your life the way you want to live it. And so I think that's why we think many of these other pieces that are having the conversation and filling out the inventory and involving people in your finances along the way go a long way towards really bolstering your autonomy, because you might not be the person who's continuing to pay the bills or making some of those decisions, but your autonomy lives on through all of that stuff that you've communicated to your financial advocate, and where you've really made them your advocate and not just your agent.
Thank you. So the next one is, I think, a more sensitive topic, but why shouldn't someone who discloses that he or she has an addiction issue and is receiving treatment, as well as abstaining from drug and alcohol use, be a reliable advocate?
Right. So in the website and in the document, I think we say qualities to avoid include having severe mental illness or an addiction. So, treated mental illness and being recovered from an addiction are very different than kind of active substance misuse. So I just want to really distinguish those two characteristics because they're really important as older adults begin to choose who they would trust, and what really distinguishes a person struggling with those issues actively and someone who has kind of found a path to kind of recover from those issues.
Can this information or the thinking ahead roadmap be found in other languages, or might it be in the future?
Not yet. We would, as Naomi said in her section of the presentation, we would love to have additional funding in order to develop a Spanish language one. But I believe that simply translating this document to Spanish is a bit of a disservice. I think that the many issues and cultural differences would be lost in that translation. So I would love to start from scratch and really co-develop a new thinking ahead roadmap with the Hispanic Latino community, so that it really speaks to what their particular motivators are, and has more of the content that is relevant to them.
Thank you. Have you considered referring to bankruptcy forms that might help folks identify such things as assets, liabilities, income, and expenses?
We have not. In our checklist, in our inventory, which I don't think we shared with you, we do have kind of placeholders and information for people to complete all of those kind of categories with their own information, but we hadn't thought about, kind of those kind of organizational partners in that. Naomi, do you have any comment on that?
No, I mean, I would love to know more of what the questioner is thinking in terms of that. I haven't practiced bankruptcy myself, but I certainly know that, we were very clear in developing this, that we want it to be useful to people all along the income and asset spectrum. And so, if anyone out there has these ideas like this particular one and other ones, I would certainly love to hear from them, and people can write to the, you can see on the screen right now, there's an email address, and that Marty will get those emails. If anything that you want to share with us or ideas that you want to share with us, I would really welcome them and would welcome understanding anything that we might have left out that's important, because this can be a living tool to some extent.
So the next one's got a bit of a general and personal piece. What course of action do you recommend when there isn't an available or capable POA or financial advocate in the family? So it sounds like their particular situation is that they care about the person and their finances, but none of the family members have capacity to handle it for the older adult. So are there any recommended resources?
Yeah, I think this is a good question for Naomi, but I will say that for participants, many of them kind of recognized how busy their adult children are. And I'm not saying that this is the attendees, personal experience, but many people said, I don't want to even think about this or do this because my children are too busy for this role and I don't want to burden them with this role. So it was kind of a matter of getting them to really think about, well, if you don't plan at all, they still might be burdened by it, but now they don't have a roadmap. So kind of reframing that. But Naomi, do you want to kind of talk about other resources?
Yeah, and unfortunately, I wish there were more resources to address this, and that's somewhat what I was alluding to before when I was talking about the solo agers. And we certainly don't mean the term solo agers to be a turnoff. People who we might consider solo agers, maybe people with very full lives and lots of friends and lots of social engagement, but be in exactly that situation where, either there are family members who just don't have the capacity to do it, or, through circumstance, those people don't exist. And it's very hard to come up with people. So if people have resources to pay someone to step in and do that, there are professional daily money managers. There are, people who used to be called geriatric care managers, and now I think are more often called life care managers. There are professional fiduciaries, and all of those kinds of people can take on that fiduciary responsibility of being an agent under a power of attorney and therefore a financial advocate, but it is for a fee. The number of programs out there for people who can't afford those kinds of fees, in my anecdotal experience, is there are not a lot of them. And in reaching out to people when we were in the research phase, I heard from a number of people. I had posted some things on listservs, and I heard from a number of people who facilitate groups of solo agers or in other ways are involved with that, and are saying, please help us come up with more alternatives for this population. There are some social service agencies that are nonprofits that are trying to fill that role, but my sense is that they're somewhat few and far between. They're probably more located in larger urban areas and not in rural areas. So it's a difficult one. And I think that's just a personal interest of mine would be to do more research on what's out there and if there are any good paradigms and how do we increase the number of those resources? Because, you know, with the demographics today and the aging of the population and more people perhaps being either socially isolated or just not having appropriate surrogates available, that's going to be a greater and greater need. So that was kind of a non-answer, but a recognition of the issue. And it's something that I hope will change as time goes on.
Thank you. How do you recommend broaching the subject that your loved one isn't as capable, maybe cognitively, physically, technologically, of managing their finances as they think they are? So dealing with issues like overconfidence or stubbornness.
Right. That's a good, great question. So I think stories were really powerful for our participants. So saying something like, Dad, you know, my friend so-and-so, you know, something happened with her mom, she's in the hospital, and now my friend has to take over the finances. And it just made me start thinking about, like, what if this ever happened to you, and what would I do? It would be really helpful to me if we sat down and worked through this together. Or maybe it would be more like you yourself start the process of creating a financial care plan. Maybe if you don't have a POA yet, you know, that you start that process, and you might come home with the experience or say, you know, hey mom, I went through this and I just did it for myself, and it feels so good to have it off my shoulders. And I just feel like, you know, so much more secure now. And so again, kind of sharing those tidbits, but not making it about, you know, the person and their declines and their current needs, but more making about like things you've heard, stories in the news that kind of say, this is an important thing and both of us should be doing this. I want to get started, you know, can we do it together? So those are just some off the cuff ideas.
There's one more piece or one other way that I interpreted the question, and that is, even if the person actually has gone through the planning process and has named someone, they may still be seeing that as, oh, that's something way off in the future. And as they get to the point where that some of those transitions need to happen, they're not recognizing that they're there yet, or that they're resisting it. And I think that's very common. And I think it's very difficult because people still do see it as giving up independence. And, you know, as Marty pointed out, there's this phenomenon of people having a lot more confidence in their abilities than their actual abilities would support. And so I think that it is very touchy. You know, it's similar to the, you know, taking away the car keys thing when people think that they still are driving fine. I mean, I know we went through this with my father-in-law who, you know, my mother-in-law couldn't see and my father-in-law had dementia and he was still driving and he sideswiped a car and they didn't tell anyone in the family because they didn't want to give up the driving. So it's a big problem. I think some of our tips about trying to make the transition more gradual and taking over perhaps some simple functions that aren't like all the major ones, like even if it's like sitting down with the person when they're paying their bills and being there with them, that might be a way to sort of make the transition a little bit more palatable because you're doing some of the smaller things together and it's not like all of a sudden someone is going to swoop in and take away all of your independence.
Thank you. We've got a couple more coming in. So does a person's will also include financial power of attorney?
Naomi?
I'll take that one. So the will itself does not include a power of attorney. Those are two distinct legal documents. It is true that often when people go to a lawyer, you know, an estate planning lawyer or an elder law attorney or, you know, a general practitioner, because they think they need a will or they want to make a will, you know, they've had children or whatever, and someone said it's time for you to make a will, that many attorneys will take the approach like, okay, you've come in for a will, but this is a time also to execute a power of attorney and perhaps a healthcare advance directive. So frequently those documents are prepared and executed at the same time, but they are separate and distinct documents.
Thank you. And then I had just a few more here. So why can't an older person just add their financial advocate to their checking or other financial accounts as a joint account holder? Would it serve the same purpose?
Naomi, do you want to take that?
Yeah, I'll take that one. And that was a conversation we had many times. And, you know, there probably are some narrow situations where doing that will work for someone, but at least in my view, in the great majority of situations, that is not broad enough. It's not sufficient, because that might mean that the person can make transactions on that particular account, but there are probably other bills that they need to pay. They may have debts, they may own their home, and that doesn't give the person any authority over those kinds of transactions. That's one thing. The other thing that I always think is very important for people to recognize is what it means to have a joint bank account. And people, there may be some unintended consequences. If they're adding someone to their bank account as a joint account holder just for that convenience, so that the person can then take over, you know, withdrawing money and paying bills out of that account, they may not realize that with most joint accounts, you know, that person then can take the money and use it for themselves, which may not be what they intended because it wasn't really their money. If that person has debts, that person's creditors may be able to reach the money that's in the account. And also, if the original account holder dies, the money in the account will just go to the joint account holder, and that might not be what they planned. You know, let's say the person had 3 children and they wanted their estate divided up evenly. They wouldn't think about the fact that the money in that account will automatically then become the other account holder's money. So there are these consequences of having a joint account that really go beyond just that convenience of, oh, this is going to be my advanced financial care plan.
Thank you. I think that really leads into the next question as well, which is how can you guard against abuse by the power of attorney?
Yeah, so in the Think Ahead roadmap, we kind of avoid the words abuse, but so the first thing and the lead into the steps is on trust, and that is the number one quality you need to be prioritizing when picking your person. And so I think that will first of all reduce many of the possible bad outcomes. But the second thing we talk about in the roadmap is setting up a system of checks and balances. So you might have your one POA, but you might have, require that someone else that you trust review annually or monthly, even, quarterly, an accounting of how the person has used your money to support you. It might be that you kind of divide up the POA roles, which makes things much more complicated, but perhaps someone is managing the investments and another person is managing the day-to-day checking. So the idea is first picking someone who you think is just of utmost integrity. And then the second thing is adding in those checks and balances. Naomi, do we offer any other advice in the roadmap about it?
I mean, not really that I remember. We do talk about things like setting up system. You can set up systems of alerts on bank accounts. There are also now some private services that will monitor accounts for signs of, fraud or money going where it shouldn't be. And so potentially you could bring in another family member or another person you trust to get those kinds of alerts. And that would be another way. I mean, unfortunately, any system or legal document or method that allows someone to step into someone's shoes and manage finances also does open the door to the possibility of fraud and misuse and theft. And so it's always a real balancing act. You know, we really want to encourage people to do the advanced planning and to name someone, because otherwise they may end up in a guardianship, and that may be, or in California, you call it conservatorship, and that, you know, has an awful lot of downsides, or maybe there's just no one. So you want to do it, and you want to make it as safe as possible through the things that Marty and I just talked about, but you never can totally eliminate the possibility that if someone is hell-bent on using that authority for ill, that may happen.
And we'll wrap it up with this quick and easy to answer question. What other things can older adults do to keep themselves safe from fraud?
Right. So as a fraud researcher, I can talk about this. I think, you know, checking in with family members, kind of getting into the habit of running big decisions by family members, bringing family or friends into kind of those kind of conversations early. You know, signing up for alerts. You know, AARP has a great fraud fighter network where you can learn all about the latest scams, and just kind of having a general skepticism about the world and about offers, never doing business with anyone who approaches you or calls you on the phone. I mean, there's so many little tips. The hard part is implementing them, and also implementing them in the face of cognitive decline.
Yeah, I would agree. There are a lot of great resources with tips, you know, both specific to certain kinds of frauds and scams, and just sort of general, you know, if the deal looks too good to be true, it probably is. You know, there are just so many of those. But I agree with Marty, people with cognitive impairment are more vulnerable to fraud. Some of it is that as they decline, they really lose the judgment to detect whether something is a scam or a fraud, and then that becomes really difficult. So I think it's a combination of teaching people those ways to be careful and involving other people to be a second set of eyes.
And in the Thinking Ahead roadmap, we do have a handout, an additional supplement that talks about some retirement income strategies that will help protect finances, and different kind of account features that you'll want to activate, like two-step authentication and, you know, alerts, you know, trying to create kind of a fixed income stream, so it's not like a lump sum pension that, you know, someone could exploit. You know, there are these different kind of financial strategies we also think can keep people safe, at least from losing like the bulk of their retirement assets.
I'll also just mention that in addition to AARP and a lot of nonprofits that provide a lot of good information on this stuff, as a former Consumer Financial Protection Bureau, you know, Fed, and I'm also doing some work with the Department of Justice's Elder Justice Initiative. A number of federal agencies really do have great resources on that. Besides the CFPB, the Federal Trade Commission, or FTC, has one of the best websites I've seen on frauds and scams, going into specific ones and having a lot of tips. The Elder Justice Initiative is good, the US Postal Inspection Service. So if you're working with people, there's a lot of free government resources that you can order in bulk to distribute to people. Your tax dollars at work.
I'm a huge fan of CFPB, and I also think the FTC site is great. I saw one person sneak a question into the chat, and I'm going to use that actually as our final question. I do think it's a much quicker answer, and that is the universal POA document, once executed properly, accepted by the majority of financial providers and programs, i.e. banks, Social Security, or is there different forms that have to be filled out for specific providers?
You want me to take that, Marty?
Yeah.
Okay. I mean, I guess first I would give the caveat that the POA document we have on there, although it's from the Uniform Power of Attorney Act, it is not necessarily valid in every state. So powers of attorney are creatures of state law. So you have to be sure that your POA comports with your state's requirements, and, you know, whether it needs to be notarized and all of that sort of good stuff. But the questioner also brings up the issue of banks and brokers and other financial institutions having their own forms. Frequently, they don't want to accept the one that you went to an attorney and had drawn up for you because they want it to be on their form. My view is that they should accept a valid POA that you have executed, that's good under your state law, and you shouldn't have to fill out another form at the bank or the broker. But sometimes people will just choose to do that and fill out that specific form because it's not worth fighting with the bank, and the bank says we want on this form. The problem is if someone executed the document and then got dementia or in some other way became cognitively impaired, they would no longer have the capacity to execute a new power of attorney form. And so that's when you have to really press them to accept the one that was executed when the person had the capacity to understand and know and want to do what they did.
Thank you very much. With that, we're going to wrap it up for today's program and share a few reminders for everyone. So Marty and Naomi, thank you so much for your insightful presentation. We also want to thank our top sponsors. So and Marty and Naomi, you can both turn your cameras off at this point. Thank you. We want to thank our top sponsors at the Diamond level, Michael Stevens, Probate and Trust Realtor, and at the Platinum level, Campbell Green LLP, Trust and Estate Attorneys. Special thanks also to our Gold level sponsors, Acuna Regli and The Tile Shop. And some more special thanks to our Silver level sponsors, Anderson, Yazdi, Huang, Minton, and Horn LLP, Fiduciary Accounting Services LLC, Holland and Knight LLP, and Professional Fiduciary Association of California. At the Bronze level, we have 21st Century Care Solutions, ARM Homes, Evans Law Firm, Golden Gate Fiduciary Services, Law Offices of Sonoy Rousseau, Law Offices of Phillips and Phillips, Lifelong Medical Care, Meredith Taylor from IMT Associates, and our special benefactors, Dan Thomas of Office Information Systems and the Office of Supervisor Wilma Chan. Today's presentation and recording will be available on the LAS website following the conclusion of this series. If you need CEU credits, please look out for the post-event email in your inbox in the next 48 hours with further instructions. We welcome your feedback about this webinar so we can continue improving the content we provide and on your experience. A link will be included in the post-event email. We invite you to sign up for the rest of our webinar series by visiting the LAS website at lashicap.org and going to events. Our next program is The Role of the Guardian Ad Litem, A View from the Bench and Best Practices on September 28th at 12 p.m. For any questions or comments about today's webinar or the program as a whole, you can email us at conference, CONFERENCE, at lashicap.org. Thank you again for joining us today, and we wish you a great rest of the week.